Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for hysteria. What is hysteria? Hysteria term was coined from Greek word hystera, meaning uterus. It was considered as a psychological disorder of women only as far back as 1900 before Christ, related to uterus. In modern times, it is defined as a nervous disorder marked by excitability of emotions in either sex. That is, in ancient world, this was considered the only women disease of women only. But now it is not so. What are the causes of hysteria? Of late, these are considered to be related to two types of disorder, namely, number one, dissociative disorders caused by experiencing some type of trauma, including childhood abuse related to physical, sexual, or emotional aspects, or being in a natural disasters like or being involved in a war. Number two, somatic disorders can ensue from childhood abuse or parental neglect, or having extreme anxiety about bodily processes or illness. A contagion called hysterical contagion, mind it, like some sort of infection. A contagion called hysterical contagion can also lead groups of persons to experience symptoms associated with hysteria. That is, it may be that a group of persons simultaneously affected with hysteria. This is called hysterical contagion. What are symptoms of hysteria? Blindness, temporary, morbid emotional outbursts, hallucinations. Hallucinations means seeing things which do not exist at all. The patient may see that some fierce animal is coming to bite her, somebody is coming to kill her. These are all hallucinations because he is seeing with his eyes, which is already diseased condition. I mean, sensation is diseased condition. Practically speaking, nobody can see this. Dramatic or excitable behaviors. This is the most important feature of hysteria. Dramatic, excitable behaviors. Loss of sensation. Being in a sort of trance. Look at the eye of the lady. This lady, I am telling this lady, this look. This is trance look. Fixed look. Developing amnesia. Experiencing paralysis, fainting, increased pain sensations, altered quality of voice. Having seizures like epilepsy. The seizures of epilepsy, next page has been given details. Spasms in throat, abdomen, and urinary bladder. This is a picture actually, the person is in epileptic, fainting, and these hallucinations. Stages of seizures. Various stages of seizures of epilepsy. First stage, aura. Aura means when the person is feeling some peculiar symptom that he is going to be attacked with epilepsy. That is aura stage. He may feel dizzy. He may feel some hallucination, sudden. He may be confused. His emotion may be distorted. His body parts may be numb. And if the person is already having such experience, he can understand that I am now going to be in the epileptic stage. This is called aura. The patient will tell that, sir or doctor, I feel this sensation, thereafter I am in epileptic stage. Epileptic stage, first stage, tonic stage. Body is arched. Incontinence. Incontinence means involuntary passing of stool, urine. Stiff body, epileptic cry. Clonic stage. Now the body is not in stonic condition, it is lateral flat, jerky movements of the limbs, frothy saliva at the mouth, blinking eyes. Then come postictal stage. That is, it is the last stage, or rather baseline stage. weak limbs are weak, exhausted, patient in exhausted condition, and he feels sleepy. This is actually just baseline or when the patient trouble has subsides. Postictal stage begins when seizures in epilepsy subside and patient returns to baseline stage. It lasts for 5 to 30 minutes and is characterized by confusion in this stage. This means confusion, drowsiness, headache, nausea, and hypertension. Now we are taking up homeo remedies. Asterias rubens for hysteria, pale face, epigastric tenderness, debility, convulsive motion of the limbs, epigastric tenderness. Epigastrium has been shown in the picture. Please write that on the right hand side. Please check it. Convulsive motions of limb with froth at mouth. A suitable remedy for hysterepilepsy. Epilepsy mixed with hysteria, full of hallucination, find relief in tears, from tears. That is, the patient feels relieved when she or he weeps. Arsenicum for hysteria. Hysterical asthma at every little excitement. Now it is asthma. Hysteria and asthma at the same time. Screaming from pain, worse at midnight, midday. This is general symptom of arsenic. Cannot lie down for fear of suffocation. Want a sip of water off and on. This is also general symptom of arsenicum. Senesio for hysteria. Loss of spirit with sleeplessness. Globus hystericus. Globus hystericus is a feeling in the throat that something is blocking his throat. Some ball-like structure or something like this is there in the throat, but practically this is nothing. Amenorrhea and dysmenorrhea. Sabina for hysteria. Very nervous, hysterical, tired and laxy. Music intolerable. General symptom of Sabina. Flashes of heat in faces with chilliness all over and coldness of feet and hand. This is also general symptom of Sabina. Lactic acid for hysteria. Intermittent hysteria. Intermittent means off and on. Nauseated when she swallow foods in morning. Get worse till 9 a.m. She vomits a large amount of tough phlegm to be removed with fingers, and sometimes problems last till 9 p.m. That is, it starts from 9 a.m. and lasts till 9 p.m. The characteristic of lactic acid hysteria. Hydrocyanic acid for hysteria. Semi-unconsciousness with hysterical spasms. Limbs, jaws rigid. Eyes fixed. Pulse very irregular and feeble. Crocus for hysteria. Hysteria with excessive joy alternating with melancholia. Childish follies. Alternate rage and affectionate tenderness. Sometimes rage, that is anger, and affectionate tenderness. Vertigo in room, better in open air. Music affects her. Staphysagria for hysteria. Great sensitiveness to the least impression. Feels offended easily. Pushes things away indignantly. Teeth with black streaks. Platina for hysteria. Hysteria in males from pre-pubic masturbation with melancholic sipic look. Sip means lamp like look. Hollow eyes, sunken and pale face, limbs spread apart, drawn down. Hysterical asthma with heavy and slow breathing. Hysteria with asthma, we have already, one thing has already been described. Phosphorus for hysteria. Erotic melancholia, hysterical laughter, increase of sexual desire with great sense of weakness in abdomen. On the right hand side, a note has been given. Hysteria is mostly acute or seldom may be chronic depending on the history of the case. In acute cases, use mother tincture 230 potency, not 3, it should be mother tincture in short interval. In chronic cases, sometimes mother tincture is required, not always. In chronic cases, use potency 200 onwards with suitable interval. With this, the video ends. Thanks for listening, viewing. Any problem, write down in the comment section. I would certainly respond.